Our next session is LHON moving forward, and I'm going to pass it on to Chris Marsh.
Thank you, Jessica. We covered a lot of ground this morning. I hope nobody's feeling overwhelmed because we're just getting started. There's a number of things that I hope, if you're taking away anything from the conversation topics that we've already covered, it's one broader theme. This community is alive and well. How about a round of applause for everybody who's putting the energy into this community and getting this going? So I recognize that, especially at the end of that community update, there were so many different topics covered that may not have all registered with each of us. So we're going to figure out some ways to make sure that that deck is accessible. If you want to go through that this evening, I can't emphasize this enough. Think about one or two topics you heard that you're really interested in leaning into further. And when we come in back for coffee and conversations tomorrow, I think there's a great opportunity to just get to know some of your peers in the community who are really helping to lead those various efforts and figure out where you'd like to be involved, or just simply be able to speak for some of these projects. That's what makes this community really powerful, is to be able to convey the message way beyond these walls. So as Jessica alluded to, our next panel is going to talk further about the science and how do we move this science forward. And I'm really pleased to have several colleagues up here, 4 different colleagues up here that I hope will also reinforce a theme we talked about this morning in the idea that the best ideas are not limited by geography. It is unbelievable to see the collaboration possibilities that exist across jurisdictions, across country lines, across companies and academic institutions, even to see where we as a nonprofit partner can actually do more than just be invited into the conversation, but actually play a very important role. And I think for those of you who heard the video earlier, you heard that as a really important theme, that your experience really matters when it comes to moving the science forward and really understanding LHON in ways that we haven't fully understood from a scientific standpoint up until now. So we talked about this theme of going global, and I think the sort of the broader theme represented by people. We had Dr. Rustam Karanja down from Toronto, who somehow practices clinic in Toronto and has his family in Hong Kong, which I don't want to try to figure out how he does that commute. But I think that's a good example of sort of thinking about global ideas. I also want to give a shout out to Pedro and Evelyn. Pedro, where are you guys? Are you in? Did you make it back? There we go. Pedro and Evelyn, raise your hands. They're up from Brazil. So we'll make sure we get to know you at reception and all, and representing the mitochondrial community, but LHON in particular down in Brazil as well. And then with me on stage, we've got a couple additional perspectives. And so you'll get a little perspective from European Union's aspect and from down under, as well as kind of representing the breadth of the United States. All right, so as we think about moving the science forward, I want to recognize that progress often comes in various shapes, sizes, and even speeds. A friend of mine who was just working on a scientific endeavor for a fair amount of the last decade had a recent success, and I was asking him, like, how did you actually get to that point? And he's like, Chris, it was 7, 8, 10 years of slogging through the hard work to become an overnight success. And I want to remember that perspective, because as hard as it feels to live with LHON, to navigate various aspects of our own lives, how do we think of then moving this community forward and building something bigger than any one of us, but also moving science forward, especially if we don't come from a scientific background. It does take the hard work to find these overnight successes. And they do come in various sizes and step functions, small steps that can lead to much bigger ones. And I think what you're going to hopefully take away is that there is a common thread and a broader roadmap that we outlined a little bit this morning, but that there's some real tangible aspects that are starting to develop, and that we're going to be really actively driving this word collaboration on many, many different levels. So I think there's a broader theme to this science, and that is, or 3 of them, I guess I will describe. One is, how do we demystify LHON sufficiently to really attract talent and capital? A second big theme of, how do we consider rare diseases as not so rare when we start to think about them coming together? So N plus N plus N. Any one small rare disease community might be too small to attract talent and capital and sufficient research. But when you start to put them together and you start to think about that collaboration word, we can actually attract a whole lot more attention and be able to actually move things forward in basket approaches. And Caramella was a good example of that this morning, as she was talking about even a basket trial of MILAS and LHON plus. These are not always easy to drive forward, but they're really important to think about new possibilities that haven't been funded up until now. And then the third big theme is around considering this global orientation to where the best minds may come at this from. So to help us unpack that, I want to introduce my four panelists who are going to bring far more scientific expertise than I do, since I'm just simply a financial wonk who's up here getting to ask some good questions and hopefully unpack a little of what each of them brings uniquely to this. So sitting, let's see, if you're facing me, it would be directly to my right is Nadia Penrod. Dr. Nadia Penrod, who joined us starting about 18 months ago as a part of the Milken Institute. You heard from her colleague, Caitlin Barrett, in the science video earlier. Nadia and Caitlin have tirelessly been helping us to really build the components of what we outlined of that scientific roadmap. And we're going to talk more about sort of the unique perspective she brings into this, helping us to think from an independent perspective where she can kind of help us see those opportunities for sparks to fly across different areas of expertise. To her right, we have Xavier Lloria. Xavier, let's see, I don't know if you're going to get the long distance commute, given that Pedro came up from Brazil and had to stop like 3 times along the way, but you came in from Barcelona.
Yeah.
And one stop. Okay, well, we're still going to recognize he's bringing a very unique perspective all the way across the pond, and we're grateful for Xavier's incredible leadership. Xavier is the medical lead for Chiesi Rare Disease, which is one of 3 divisions within the Chiesi group based out of Italy. And uniquely, as I've gotten to know their organization and Xavier in particular, they bring a perspective that is different than your average biopharma. They are not some publicly traded company that is, dependent on quarterly earnings reports. They're privately owned. For how many years? 90 years this year, 90th anniversary. As a family-owned Italian origin organization, but truly a global team. And Xavier in particular, as the medical lead, has a deep understanding of LHON, a deep understanding of some of the therapeutic possibilities, and has been explicitly inviting your input to help really understand sort of the broader circumstances within the whole body aspects of that. To his right, we also have Sean Murray. And Sean has joined us from, did you come up from Sydney?
Did.
From Sydney, Australia. And sometimes you stop along the way and make really good use of that
I stopped in
trans-Pacific.
Dallas just at the airport. It wasn't my most fun experience.
Sean admitted that he slept all the way through Mexico or over Mexico on his way into Dallas. But those of us who connected through Chicago or Dallas understand. That's great. Sean is CEO of Mito Foundation. And so if we think about UMDF here in the United States, and tomorrow you'll hear from Kristen representing the new leadership here, Sean brings a really amazing perspective of the same type of orientation across mitochondrial diseases from down under. And we'll get a little perspective on what that offers to this broader conversation. And to his right is Karmen Trzupek. And Karmen is one of the senior directors at RareX Global Genes. And if that rings a bell, it's because you've probably heard Melinda or others talking about RareX and the data collection program, otherwise known as the DCP, on many occasions. It turns out actually RareX and Global Genes is bigger than just a single DCP or technology platform, and really has been an amazing partner to us as we think about some of the points of commonality that we need to better understand for those basket type of trials or those broader basket learnings. So with that, we're going to dive right in and get going with some of the science. So Nadia, let me start with you. We left off this morning describing a little of the scientific roadmap and the important role you in particular and Milken Institute have played in helping to navigate the LHON rare disease and how it fits in. Do you want to just describe a little bit of where we stopped about this opportunity map?
Thanks, Chris. I think I'm going to start by picking up on your point of collaboration, though. And I want to be very, very clear that my colleague Caitlin and I did orchestrate everything I'm about to talk about, but it came from a hugely collaborative effort with the LHON community and researchers from around the world in other topic areas that have viewpoints and technologies and things that are directly applicable to the work that could be done to move LHON forward. So to be very, very clear, there are about 100 perspectives in this map, and I hope I can answer any questions you have, but the expertise comes from all over the world. So at the end of a process I know you've heard Chris talk about before that involves landscaping, the literature and the funding status and talking to experts and meeting together for a scientific convening, we essentially synthesized the information and distilled it into 5 key areas where we see a lot of opportunity to advance LHON research. And we're displaying it here in a chart. On the right-hand most side are the goals. In the middle is a roadmap, activities independently that can be taken to move forward. But what we're going to focus on today is the left-hand side, the why it matters, why it will be beneficial to the community, because we ultimately we want to be certain that anything we would advise move forward is moving forward in a way that is directly applicable to benefiting the people in this room. So we'll go from the top to the bottom. The first area we've identified is collecting comprehensive patient data. And I know there was conversation about this morning, and Melinda had a QR code where you could start entering data if you haven't. The reason this matters so much to the research and clinical communities is because this is where people working in the field can begin to identify patterns that will allow them to develop better clinical tools and to personalize care for patients. The more complete the data are, the faster these patterns can be identified, the faster we can find insights that will lead to more effective treatments. The second area is fostering a robust research and development ecosystem. In this area, we're specifically focusing on disease models. So disease models are what researchers use to do experiments. It's how they try to understand biologically what's happening in a closed and controlled system where they can make changes and watch what happens. The types of things we don't want them to try to do in humans first. And so disease models are essential for all of that discovery and for preclinical safety and efficacy testing to make sure that what they are pushing forward to get into humans has a biological effect, but also isn't toxic and isn't going to cause unexpected problems down the line. So good models really accelerate research and they reduce the risk of failure later in the developmental process. The third area is investing in platform technologies and partnerships. So this also comes back to collaboration and the idea that there are lots of opportunities to create shared tools, technologies, and partnerships with other disease areas. We're here at UMDF, so other mitochondrial diseases, other vision-related diseases, where progress can be accelerated by working together. And this is hugely beneficial in rare diseases where resources are constrained. It prevents you from reinventing the wheel and it breaks down silos so that you can get to these breakthroughs faster. The fourth area is supporting patient-centered clinical trials. And this really matters, particularly in your community where you've seen outcome and endpoint measures for clinical trials that don't necessarily represent your lived experience. So when you design trials with the patients, not just for them, it makes the results more relevant, and reflecting patients' needs and priorities and daily realities mean trials are more likely to succeed. So for tangible example here, the number of lines on the eye chart was mentioned this morning. For some individuals, that can be really meaningful impact, but for others, it isn't. So what does an endpoint look like that really changes the way you move around in the world? Those are the kinds of things that we want to be focusing on if we invest in this area. And the last one is raising awareness of LHON in clinical settings and building a talent pipeline. And so this really is impactful in clinical settings and also in the research setting. To get a timely diagnosis and to get effective care, it really starts with having clinicians who recognize the disease, who can give you an early and accurate diagnosis, and researchers who are committed to solving it. So raising awareness and training the next generation through courses and fellowships and the things that provide support to allow them to build their careers in the LHON space ultimately leads to better care and faster results.
So that's a great overview of 5 big topics that have a whole host of different projects. We're not going to go through every one of those in the middle of the slide. We will share this as a follow-up so that you can actually dive a little bit deeper into it. And feel free to talk with Nadia at Coffee and Conversations tomorrow if that's helpful. Xavier, I want to maybe ask you to jump in and build on a couple of the comments that Nadia has just referenced there. But you so eloquently in our science video talked about everything that the patient community is experiencing is important and not to be overlooked. Maybe we could dive in with a little of your unique perspective and build on that thought.
Thank you. Absolutely. The data that we need, especially in rare diseases, is that every single piece of information counts. And that means that we don't have in some way the luxury of having lots of databases and lots of previous experience, etc. And you are the ones that, suffer things, feel things, and see the response to things that, trials and treatments that one can develop. So normally there is a tendency that, the one that writes is the doctor and the one that listens is the patient. And this is not really. I mean, I'm very strong about there needs to be this communication. And I take it one step further. I mean, physicians, experts are experts, and they can develop beautiful, beautiful studies. However, they miss or they don't have the expertise in terms of preparing those data to be submitted to authorities. So here is where this communion, this exchange of information is important. So we can design a perfect clinical trial, but if we don't count on you, on what really matters to you, how it really matters, we might really miss the point. So this is why I think it is extremely fundamental. Don't be shy. Don't be shy. Doesn't mean that you know everything, but I mean, I might look at something that really is not important for you. As I was saying earlier on, moving around might be something important. Can we measure it? Maybe it's not easy, but that doesn't mean that we cannot do it or we shouldn't go for it. Okay.
Great point. I think we all take that to heart. And the best part is we have some systems to now actually play that back to you as partners and be good partners in advancing that understanding. Sean, let me bring you in, and I want to specifically think about your broader perspective at Mito Foundation in Australia. We left off this morning talking, well, actually about mid-morning, we talked with Ann Caramello about LHON plus and these broader mitochondrial symptoms that everybody's experiencing. And Xavier is kind of reinforcing the importance of verbalizing and really capturing it in some ways. But maybe just give us a little perspective. What should we know about how Mito Foundation and the Australian health system sort of comes into this dialogue and where LHON fits?
Yeah, great question. I think what strikes me as we consider LHON and as we consider it in the role of broader mitochondrial diseases is the tactics as to when we take on the role of lumpers and when we take on the role of splitters, and sometimes you need to do at different times you'll need to join things together for more momentum and more effectiveness. Sometimes we need to split it up to get some more specificity. So where does the role of LHON fit in the Australian landscape? It is, well, we are fortunate, and I'm reminded of our fortune of our health system in Australia. It is by no means perfect, but it is broadly accessible and it is independent of insurance and those sorts of things. We're really fortunate in that regard, where it's not something that is relevant. And yeah, it isn't perfect, but it is broadly accessible. We have some very zealous clinicians, and what a fortunate thing that is, because we've seen in other mitochondrial diseases within Australia that, funnily enough, the well cared for community members seem to cluster around very passionate clinicians, and we've got a number of those in Australia in the space of LHON. Mito Foundation, when it was established back in 2009, while it was modelled on UMDF at the time to be representing all mitochondrial diseases, we did manage to connect with some LHON specialists from the early days. So having a focus on, or at least a connection with LHON, is part of our core DNA. So we've been, very fortunate to connect with some experts from day one in a system that does tend to catch the majority of people who have a specialist to go to. We've got a small population geographically spread, but it is rather concentrated around the coast of Australia, and this particular clinician travels. And how fortunate they are. We've integrated some of our support services, because we both fund research and provide support services, and we're integrating some of our support services directly with the LHON clinics or the vision clinics, where we can then take it beyond the clinical setting and then try to provide practical supports to part of the LHON community. So we try to do it all.
We know it can't all be done, but I
Yeah.
really appreciate the mindset of how do we advance that. Karmen, come on into this conversation, because we've just sort of seen or heard from Sean a broader perspective of the mitochondrial disease landscape, but both from your background as a genetic counselor, seeing the strengths and the limitations of a genetic diagnosis, maybe not fully capturing what a human being was experiencing. Help us sort of put this in perspective. Where does LHON fit into this broader global landscape of rare disease?
So, so for background, at Rare X and Global Genes broadly, we support hundreds of rare disease organizations, and Global Genes really got started as a nonprofit advocacy organization to fill in the gaps and the holes of where really small rare disease communities need extra support. And even today, when you have organizations that weren't around 17 years ago when Global Genes was founded, right? LHON Collective was not here 17 years ago when it was founded and needed a lot more supports. Today, you have this incredible organization, you have this room full of people, there's a lot built. But even today, for most of those rare disease organizations, within their structure, within their board of directors and most common volunteers, there will be kind of holes in the expertise or in the needs. And so just for background, that's kind of broadly what we try to do, is fill in those needs. Most of the work that I do is on the research side. And so on the research side, what we've done that's a little different and something that we'll talk about up here is that we've really tried to approach rare diseases as sort of clusters of diseases. There are over 10,000 rare diseases. And if we try to develop research strategies and therapies for each one at a time, we will never get there in a time frame that we all want to happen. So there's got to be some degree of collaboration and efficiencies created. And so part of what we do with the data collection program, when you go in there, admittedly, there will be some things from time to time that you might think that's oddly worded. Why would they word it that way for LHON? Well, it's because it wasn't worded for LHON. Yeah. It was worded broadly when there are questions, for example, about muscle function or about coordination issues. These are things that you heard this morning are really, really important for understanding LHON plus, or this sort of extended LHON syndrome. But we can look at that across any disease that also has those kind of symptoms. So other rare diseases that also have these sort of MS-like pictures, right? We can look at that very similarly across those. And so that's really kind of the tip of the iceberg, and how we start to think about how do we bring similar diseases together, which are different. And I'll say one thing about this: similarities can can have multiple different sort of overlapping bubbles, right? In the Venn diagram, there's actually multiple Venn diagrams. So LHON is obviously very connected to many other mitochondrial diseases, and you're here as part of the UMDF and that larger conference. But we also look at things like, well, within communities that experience vision loss as the primary symptom of their condition, that are rare and that are inherited, what are the similarities between them? Well, there are similarities in things, for example, like how do we design better outcome measures? Nadia just mentioned this. How do we design better ways of assessing what does vision improvement look like in a clinical trial? And that's something that we should be able to do with those sort of sister diseases and organizations.
It's a group. Yeah, please jump right in.
I would also say, I think an excellent point that comes out of that is thinking about the LHON plus symptoms and thinking about looking at symptoms that might be shared across these mitochondrial diseases. Something that's really important in the voice of the affected people is prioritizing for the clinicians and researchers which of those symptoms are the most important to you, because there's not always going to be the case where there's a full cure. Sometimes it's going to be, we can solve some of this. We can help minimize or mitigate the effects of some of these symptoms you experience. So when it's things like that that cross these areas, if there are multiple communities that say muscle weakness is a problem, maybe there's a therapy that addresses that doesn't completely cure the condition, but it significantly improves quality of life. And those kinds of that kind of input and feedback to the research and clinical community really helps them understand this is where we should be focusing.
So I love this point, and it gives you a depth around the first of the 5 areas on the opportunity map that Nadia referenced. Karmen, let me stick with you to maybe just elaborate a little bit on these conditions in particular. And we've gone through the LHON data on RareX, and Melinda would kick me if I didn't remind everybody. This is patient-owned, meaning your data. Patient provided, thank you for taking the time to continuously update these as your experience changes and evolves. And it's with the data security platforms that now allow it to be a truly global platform. But you want to give a little perspective on maybe our first of 2 slides on LHON and in RareX?
Yeah, I would love to. So, and I'm going to say something. Oh, Melinda must be in this room, right?
She is.
Okay, so I'm going to say something, Melinda, that you might get a tiny bit mad at me about, but I hope not. Okay, I know now I've said something, you're like, oh, she's going to say something provocative. I have to pay attention. So right now we have more than 250 people enrolled within the RareX data collection program for LHON. And yesterday I was sitting at a table where there was this sort of like disappointment expressed by a couple of people that like, gosh, it's going to take us a long time to get to 1,000. Like I'm feeling disappointed. And if we can't get to 1,000, is our data even worth it? And here's the part that Melinda might get mad at me about, is that here's what I told them. If I had to choose, and thankfully I don't have to choose, but if I had to choose over the next year, whether I wanted to continue to grow that number beyond 250, but have everybody sort of just enroll. So we just know like who you are, where you live, what your mutation is. Or if I had to say, you know what, I'm just going to pause growth and enrollment. And instead, I'm going to get deeper data. I'm going to get everybody who's in this database to come back in to fill out these surveys that have really been developed like hand in hand with the community to capture what we really need to hand over to researchers. That's what's going to help drive research. It doesn't actually help drive research per se to just know where everybody lives and what variant they have, what mutation they have. But the kind of data that we are collecting, if we get that completely, is really going to drive a lot of research that's going to answer some of the questions that are floating around. Questions like some of you probably saw this morning, there was this old statistic that if you're male and you're under the age of 26 and you have inherited an LHON mutation, you have 50% chance of developing that. And we know now that the risk is actually much, much, much lower than that. And part of how we know it is there have been population-based studies in places where they've done large population genetic testing of individuals who don't have vision loss. right? And what we find is a shockingly higher number than anybody would have guessed, right, of some of these mutations. And so what that tells us is, okay, a smaller number than we thought would actually go on to develop the vision loss. Why? And you heard this morning, like that's a big, big area of research. Why? What are the triggers? What can we do to prevent it? Well, some of the data that is in the Rare X data collection program now, but only by some of you, tells us about family history. And so we have information on families who, on individuals who say like, I have a family history. In fact, I think I have this on the next slide, but I have a family history where I have 12 people in my family who are affected. But then we have a whole bunch of people who've told us nobody else in my family is affected. Like that is an opportunity for research, right? I would love to have that on all 250 to be able to go in and say, okay, what are the differences between these families that have more than 10 affected individuals and those who have 0, right? So there's so much in this that isn't just fueling research today, but is really fueling the opportunity for more research.
If I did just go to your second slide and make sure that we hit that point. I think this is an important moment just to pause. This is more than just asking you to fill in some survey. And I'd like to invite maybe each of the 4 of you to kind of comment on this, but with the advent of artificial intelligence, these tools and their ability to help us systematically look across individual rare conditions and look for these points of commonality is unlike it's ever been before. The possibilities are so much deeper. We need your perspective alongside any clinical records, any electronic health records, in order to really be able to make the most of the depth, Karmen, you were just sort of emphasizing the importance of. I know each of you are kind of thinking about this from your own perspective, so chime in here. I could go down the line, but I'm going to guess one of you is going to step right up.
The thing that struck me, I'm going to jump right in, is the quality data comment. And without that quality data, we wouldn't get those insights. That body of research that was an epiphany around the actual penetrance of symptoms in people who carry these genetic changes. I think not only is it insightful from a general community field perspective, but as you said, how many research questions does that now open? How many opportunities for progress does that open as well? And all coming down to quality data, that resonates very strongly.
And I agree. Garbage in, garbage out. So that's something that we have to watch carefully. Talking about artificial intelligence, I do believe in it, of course, but it's a little bit, you have to be careful because they are not intelligent as such.
Yet.
They can come with information that might not be, that good. So you have to be there watching, keeping an eye and making sure that things make sense. The advantage of artificial intelligence is that it moves extremely fast. It can go through a bulk of data in no time. That it really accelerates. But anyway, we have to be careful and watch the results that produced, whether they make sense or not. That's why we're here.
Right, right. Now you put it maybe in perspective of just some of the other of the 5 core areas on the opportunity map. You talked, I think, about the third one as building some of these platform technologies to actually help think about this and what that does for the second one of really fostering an active and energized research environment. Does this make a difference?
Artificial intelligence?
All of the depth of this richness of input and how we actually foster and maybe even invite new researchers in, right?
Yeah, absolutely. I think there are researchers working across a whole spectrum, from people who are really focused on a single gene or protein to people who really care about a disease area to people who actually just develop tools and technologies like artificial intelligence and other types of algorithms that analyze data. And those people are often looking for application areas of their tools. They've developed something that they think is really amazing, often using synthetic data. So they're generating data sets to optimize their work, and now they need places to apply it to show that it has real world relevance. And what they're looking for are really rich and complete data sets. And I also will add to everything everyone said here, that I think this is also a call for collecting data from the unaffected carriers in the room. Being able to have something to compare to is something that really makes this even more powerful. And if you are family members of people that are affected, all other things being equal, you're sharing similar environments, you're sharing a significant portion of your DNA. So those other background genetic factors that Ann Chiaramello spoke about this morning, I think can be hugely, hugely beneficial. So having these rich data sets that these really powerful tools can analyze in very quick time only works if you have the type of data you need to get useful output.
Excellent point. Xavier, maybe just to bounce back to you, because you are also thinking about as new therapeutics are developed, there is, of course, the challenge of trials and eventually gaining approvals in order for these to become accessible to the world, to all of us.
Yep.
Do these other data points come into how a regulator might someday consider success?
Yeah, I mean, information is critical. So the more information we have, the better we can, let's say, analyze, compare, rule out, find trends, find lots of things. So that is really important. When we develop pharmaceuticals, obviously we have to think and find a regulator, the one that is going to approve it, which sometimes has a specific mindset in general disease, in big diseases. And in rare diseases, it's a completely different ballgame. You will never have, the numbers that you have in hypertension. So you need to be a little bit accommodating. You even need to question the p-value. I'm being very daring here. So, and this is something that we need to, interact with the authorities. And for that, that's why it's important also the data, because then you can show them that I don't have, 5,000 patients clinical trial. I've got much less, but look at all the information that I've got and how this later on can be applied to the population. And let me just bring something in here. Why data that might seem not important for you, or to you, sorry, is important is because then later on you have another figure out there, which is the payer. And the payer needs justification to see why we're going to spend this money. So the more information that you provide them, the better. And that makes, at the end of the day, the pharmaceutical more accessible or easily accessible to you. Okay. So designing clinical trials is not what it used to be anymore. I mean, it's now you have to think in terms of regulatory payers, patients, physicians, because they are still set in ways, in designing trials in a way that maybe for rare diseases is not the right one.
Best description I heard recently was it's multi-layer chess or multi-dimensional chess game to both anticipate these things as well as the technologies and the different constituent groups who are going to look at them differently. So we've talked about how important your lived experience is. You've hopefully heard the data and technology tools that we can actually help capture this, and that those are important parts of putting LHON in the perspective of not only the mitochondrial community and other mitochondrial conditions that might present similarly, but we also talked this morning about building a vision consortium. Karmen, let me get you to chime in, and I've got one more slide I think that you have offered up about building a vision consortium. Why would this matter?
So I touched on this a little bit before, that there are multiple other rare diseases that exist where vision loss is the primary symptom that occurs. It's the primary issue that people face, and that they're really hoping that therapies will come along to address. And broadly speaking, these tend to fall under one of two categories: inherited optic nerve disorders, which LHON would fall under that category, and inherited retinal diseases. There's some argument that some people would make that those should really be kept separate, that the similarities within those categories are greater than the similarities between them. We have not taken that approach, and we haven't taken that approach for a couple of reasons. First of all, because the optic nerve is fundamentally deeply connected to the retina. Some would call it a part of the retina, some don't. It's kind of a debate, but it doesn't matter. It's deeply connected. All of these tissues are connected. In fact, almost everybody who has an inherited retinal disease will eventually develop optic nerve disease. So it's very clear that that the connections exist on a biological basis, and the way that we think about therapies are going to have some overlap. But from a patient perspective, it's also really, really important. And I think a lot about efficiencies, like how can we create efficiencies between communities? And those efficiencies exist on multiple levels. Like at one level within the Vision Consortium, we think about efficiencies in like hey, your organization, so Usher syndrome is a community that's part of this community. And the Usher syndrome, and the Usher Syndrome Coalition in particular, this organization, it's a global organization. They've done an incredible job of developing an ambassador group where they have these ambassadors in different countries and different states. And it's sort of a train the trainer model. And they have really taken under their wing some of the smaller organizations within the Vision Consortium to help show them how to do this and how to find your ambassadors and how to really train them and how to help them feel like confident. And so like, that's one way that we think about efficiencies is you don't have to figure all this out on your own. There's somebody who's done this before, and then there's the research end where we think about things like, how do we measure real improvement in clinical trials and what does that look like? And as many of you in the room know from personal experience with LHON, for most people, the primary concern is loss of central vision. But for some people with LHON, because part of the optic nerve is responsible for your peripheral vision, they actually have some peripheral vision loss. Well, guess what? The primary problem in inherited retinal diseases, by and large, is reduced peripheral vision. So anything they learn that's applicable to clinical trials for individuals who are losing peripheral vision is going to help the LHON sort of pocket of individuals who have that kind of vision loss. So there are just so many opportunities where it does not make sense for everybody to keep plodding along by themselves, where, we think doing this together just makes more sense.
So to Karmen's credit, she's literally been pumping oxygen into this from day one of creating this Vision Consortium. And we didn't get a picture of it up on the slide, but I want you just to close your eyes and imagine this idea of up until now, you end up with each individual rare disease kind of going about their own thing, funding their own research, talking with their own researchers about their own conditions, and each just trying to move things forward. No wonder the rare disease world lives in such scarcity, right? That's not, to use your word, efficient. That's not exactly the model of efficiency, right? So instead, about 4 weeks ago, over in Salt Lake City at this ARVO conference that we referenced earlier, ARVO, the Association for Research in Vision and Ophthalmology. I'll get it right eventually. We had this opportunity to take this Vision Consortium and bring the collective network together, and it manifested itself into an incredible reception. We didn't end up with 50, 60, 70 people. How many people were there?
I don't know. Normally event planners will tell you whatever number you invite, assume that no more than 2/3 will say yes, and then assume that at least 25% of them will no show. So we invited 65 and I think we had like 85 show up. I mean, people were emailing me like the day before, 2 days before, like, well, actually there are 3 more people on my team who really, really want to meet this person and this person and this person. Can I bring them? And I was like, well, until the restaurant kicks us out, I'm just going to keep saying yes.
So I think this is a perfect example of where we don't just live in a virtual world, but we can take advantages of some of these conferences. We can build awareness of LHON, but we can also build something that's bigger than us and really advance something in some new ways. And Xavier, I'd love for you to jump in here as well as Nadia, because you were both there. And Sean, you even had one of your members of your team there. So we truly was representative of the entire panel now that I think about it. But, Xavier, you were having conversations with one little breakout group who's thinking about a whole new delivery modality. Yeah. In using the eye. And maybe it's not just system-wide, right?
Exactly. It's the beauty of these meetings and the beauty of bringing different brains into the same room, and people have different approaches. For me, it was an eye-opening learning about that delivery method.
Pardon the pun, the eye-opening moment.
Sorry about that. But anyway, we've been thinking on, new forms of delivery, new forms of pharmaceutical forms, and then you come across this and you say, wow.
Yeah. Yeah.
Otherwise, I haven't heard about that. So, and it was great to have those people there.
And Nadia, I'd love for your perspective here, because we talked a little bit on that opportunity map about how do we think about some of these new platforms and new approaches, and maybe the best ideas aren't necessarily going to be invented from scratch.
Yeah, I think that's definitely true. I think one of the really great things about that event was seeing the scientists and the clinicians interacting with all of the different foundations and people involved in the Vision Consortium, and the ideas, in addition to delivery mechanisms, a lot of ideas around data and around the similarities that can be leveraged as I think we've covered extensively already on this panel. And seeing new people connect and researchers who are maybe working in one area who recognize that their efforts are really helpful in other areas. And some of that was around things like regeneration, the stem cell work, and the technologies around that, that if you can figure out how to regenerate the optic nerve and how to get it to connect to the brain, that helps with all of the inherited optic neuropathies. And so I think those kinds of connections don't happen necessarily outside of events in real life where people accidentally bump into each other and figure out what they have in common.
Yeah, I think that's such an important point, and I'll remind what Dr. Karan just said this morning about we're not ready to jump out and start engaging or embracing stem cells yet, but your point is spot on. We actually have research teams elsewhere around the globe right now who are using stem cell regeneration to be able to model what we are experiencing in our body, and before bringing new therapeutic approaches, be able to test it out and actually use human tissue for some of this, right?
Yes, talk to your doctors.
Sean, let me come back to you just for a perspective on this, because sometimes it is described within the Mito world that LHON and the vision impact is referencing the eye as a privileged space in the body. What does that actually mean? And how, when you think about so many of the mitochondrial conditions you represent, there's like, it's system wide, right?
Yeah.
But some of these things could be tested out in tissue specific approaches that might inform things down the road. I'd love your perspective on that.
Well, absolutely. And certainly I think that from the early days of the establishment of the Mito Foundation, we've known that the space of LHON is at the avant-garde of this whole field. And if particularly when we look at things like potential therapies in, say, the gene therapy space, where we've got a localization of the symptoms, this space will be the first to go in that space. And that will be an exemplar then for other mitochondrial diseases that are more systemic. And then they have that. So there's one less hurdle to face in this space, and there are still a lot of hurdles, but there's one less on the where the mitochondrial diseases are impacting, multiple systems. So we've very much been aware of that and focused on that. In fact, one of the early research grants that we funded was Dr. Raymond Wong out of the Centre for Eye Research in Australia, just happened to be there, in looking at a gene therapy for Leber's hereditary optic neuropathy and DOA, I think. But I think that's a really interesting consideration. And obviously, then you've got the other side of that coin is when it's not just localized. Then we've got the broader perspectives. The thing that's striking me and what I'm hearing here is that, and I touched on that term, lumping and splitting. Sometimes we lump, sometimes we split, and we have to be. It's a little bit quantum. We need to be able to be two things at the same time, and that's okay. And it's not just two things in one dimension, but it's multiple dimensions. So we're playing multi-chess, we're doing quantum physics and AI. So we're doing it all.
Is that all?
I have a computer science background, so I like that kind of stuff. Yeah. The wrong science, I think. Yeah.
So Nadia, maybe we can kind of bring this back to the broader sort of opportunity map. We've talked a lot about how do we understand all that's cumulatively known up until this point? How do we think, obviously, based on the panel conversation today, about the intersection with other rare diseases, with other vision-related delivery modalities or opportunities to understand things? You're about to launch something that we call our resource research working group. Why don't you unpack a little of what drove that, and what is that going to look like?
Sure. So this speaks to our second opportunity here, and this is making sure that we have the tools we need in the ecosystem to advance the research. And so we have asked two of the leading investigators in LHON, clinical care and research, Patrick Uwe-Mann out of the UK and Valerio Corelli in Italy, to be co-chairs of a group that will bring together themselves and 8 other researchers from around the world, from Boston to China, to start to catalog and characterize the existing LHON disease models in a way that we can comprehensively understand what is out there and what is available to do the research. They have 3 goals. That is the first one. The second one would be to identify the critical gaps what is missing in terms of availability of models that are out there? Are they available? Are they being shared? Are they usable by the community? Are they relevant to LHON? Are they really modeling what they need to model? Or are they sort of a surrogate that's not quite what it needs to be to get to useful outcomes? And third, the utility. Where are they useful in the system? Are they early discovery tools, or are they close enough to LHON that they're really the thing that could be applicable at the end of the pipeline to figure out the efficacy for treatment? So that would be a second area, identifying where there are still gaps. So what needs to be done? And then the third goal for the group is to start to think about what a investment in future research would look like that starts with model development or optimization if there are models that are close but could be better, and also the application. So this is the important part. How should we be using these models to conduct research to make sure it aligns with the most pressing and unmet needs in the LHON field? So I think we're really excited about this. It's going to launch next month. And I think everybody on board is really engaged and interested. And it's the kind of thing that once we have it, we can distribute it to the entire research community, and everyone can use their favorite technologies and tools and discovery methods to then feed back into the system and help us learn, where we could be going. And sometimes models help you ask better questions, even if they don't immediately give you the right answer. So this is something that's really, really foundational that can really advance the field.
You know, I came into this whole rare disease world feeling like there was sort of one institution separate and like these big walls between institutions and this real challenge of driving collaboration. And I'm reminded of a phrase that I learned early in my business career, that organizations don't make decisions, people do. And if we really think about who is doing this research, it's not organizations, it's not institutions, it's not even lab team or labs themselves, it's teams of people really doing the work. And what's really blown me away, and frankly, each of your organizations that you are representing up here on this panel are just model examples of how do we foster that collaboration among human beings and generally try to achieve something that's bigger than just the research. This isn't about science projects. This is about finding a cure. Let's be very clear on the goal, right? But I think as you're also hearing, there are a number of ways we can imagine iterative steps along the way. We don't want to set unrealistic expectations. We're not there. We're not even understanding enough of how LH1 manifests in the body to fully be able to target things accurately yet. But it doesn't mean we're not going to be able to figure that out, and some iterative steps along the way to actually improve that quality of life you described earlier.
Yeah, and I think to be really clear and to your point, the idea of creating a roadmap like this is to figure out how to connect all of the pieces to make sure that we're moving in a productive direction. And so what we're ultimately recommending here is a way to connect the data, the models, the technology, and the people, the community in this room, and the research community in LHON to lay the groundwork to be able to do faster diagnosis, better treatment. And we're really trying to envision a future where every person who gets an LHON diagnosis has access to the knowledge, the support, and the promise of effective treatments. So even though we're not there yet, there is promise, and we have to be able to build a path to get there.
So I love that message, and I love the optimism and the dose of realism that we've kind of talked about throughout the day. All right, in my final, maybe 1 minute with each of you, I'd love to throw my little curveball question at you. Karmen's already bracing herself. So we've covered a lot. Each of you have a lot more that you are actively advancing on a weekly basis. What did we miss in the conversation today that our LHON community should know, and what gives you hope? Karmen, you want to start us off?
I get to start. Well, at the very top, when you talked about like, what are some things that we want to talk about as a panel today, you mentioned, how do we get more researchers involved and invested in LHON? And you might think I would be the least likely person of the four of us to talk about that. But I actually think when we think about the RareX DCP, right? So what you all have control over, you joining that registry and putting data in there. RareX does not have a huge data analytics research team that's doing the research. Our remit, our mission is to provide the technology and the support to make that data available to researchers. So the more data that we have available, like if I was a fellow or a PhD student who was studying ophthalmology and somebody said to me, there is this incredible database of 250 people with all this incredibly rich data, and you can have it. And you can write an amazing paper and you can be the first author on a scientific publication. Sold. Like that is sold in a heartbeat. Like, let me be first in line. Please don't mention, like, psh, don't say it to anyone else. I want that. Right? Right? Like that is gold for a budding, developing researcher. And usually those are the kind of people who haven't quite decided what their niche is yet, like where they're going to focus their talents.
This is what I mean by recruiting talent. We have to be actively encouraging them to step into this field.
Yeah.
We definitely need that next generation of researcher. Sean,
Yeah,
what other topics did we miss and what gives you hope?
well, that theme of around attracting, how do we attract people, how do we attract funds into this space and into any space that we want to invest our energies? I think a structured approach, a plan, a well-organized, collaborative, collective, to use the term, success begets success. People will follow where there's momentum, and I think that there's what I'm seeing here and what I'm hearing is intent, and I think if the community more broadly, the message would be maintain the faith. This is going to be a long road. There are going to be hurdles. There are going to be curveballs and side streets and forks in the road. But without faith, without investment, and without persistence, and without the grind, it won't progress. I think the term that comes to mind is snowball effect, and with momentum, it will attract people into the field, the researchers, and then with researchers and with momentum, then it will be a more attractive proposition to bigger scale philanthropy, and that will just compound things, and ideally we'll get that exponential effect.
We love working with you, Sean, for exactly that reason. Thank you. Xavier.
Well, I was actually thinking on what Karmen said. I mean, I thought we're missing the people, the human factor here. And so you've brought up a very important aspect, how to lure these green shoots, these young investigators, these young future experts into spending time and effort in LHON or similar diseases. In my previous life, I mean, other companies have done that. And it's not easy, but I mean, once they see that there is this opportunity for publishing, for going to congresses, to present papers, to present posters and all these sort of things, they start getting interesting, because at that stage in your professional life, that's what you want. Okay. That also brings me to another topic, is that we need that, because like everything in human, I mean, experts at some point are going to be old. They need to be renewed with new blood.
Yeah.
So that's why we need to start now to create this new generation. And also because competition is good in the sense that you cannot be just the one and only. What makes really things move ahead is knowing that your neighbor is doing. This happens in pharma. Other companies that are moving, then your company moves, and that's eventually what makes take the next step. When are we going to get to a huge level of awareness? When we develop new treatments.
Yeah. And get approvals and be able to make them accessible.
Exactly.
Nadia, bring us home.
All right, I'm going to pick up on that note and say something that gives me great hope in this field about the next generation is LHON has incredibly intelligent, dedicated scientific researchers who are very aware of their legacy and how they are going to make sure the work goes on as they're nearing retirement. And they have been so open with us. They have welcomed us into the community, sharing their knowledge. And as we have worked to bring new voices to the table, these people Chris mentioned who hadn't heard of LHON before we reached out to them and asked them to talk to us about their model systems and their technologies, who came with us to Lisbon, and now who the LHON community has embraced and who they are very willing to work with and teach them what they know to make sure things are moving forward. I think that it is such an amazing research community that really are your advocates. They really know that the work they're doing matters, and they're very happy to make this tent bigger and to bring in new voices. And so I think as we find people that we think we can engage, there is already a wealth of knowledge there and something they can plug into to get up to speed and to come along. And I think it's an incredible, incredible thing that you don't see in every community, which I think you can speak to from other rare diseases. So I think there's just tremendous amount of potential here.
So what each of them have just shared, and frankly, their activities and their leadership on a day in and day out and week over week basis, it's what gives me hope. Would you join me in a round of applause for our panel? Thank you.